Hello, I'm Felicity Ford, and my research topic is on postpartum depression. So, within 1 to 3 days of delivery, new mothers may experience the baby blues, which is a less severe version of postpartum depression, and it's pretty common. It'll last about 2 weeks, and about 50 to 75% of new mothers may experience baby blues. Some symptoms of the baby blues are anxiety, crying spells, and difficulty sleeping. And then we have postpartum depression, which is also known as peripartum depression, meaning it started during pregnancy and went on after delivery. Some symptoms of postpartum depression are very similar to baby blues, like anxiety, crying a lot, and difficulty sleeping. And there's also intense irritability and anger, difficulty bonding with your baby, and thoughts of not being a good mother. About 1 to 7 new mothers may experience postpartum depression, and it may last up to a year, sometimes even longer if left untreated. A more severe version of postpartum depression is postpartum psychosis, which may affect about 1 to 2 in 1,000 new mothers, and immediate medical attention is recommended because it can be dangerous. Some symptoms include hallucinations and delusions, and also thoughts of harming yourself and your baby. There's also paternal postpartum depression, which affects fathers. So fathers who have a partner who is diagnosed with postpartum depression are about 50% more likely to develop it themselves. And as a new father, if they have experienced financial struggles or relationship problems in the past, they're also more at risk of developing postpartum depression. The causes of postpartum depression are currently unclear. There are a few theories such as genetics or the drop in hormones, estrogen and progesterone, because those hormones are at very high levels during pregnancy, and immediately after delivery they rapidly drop. There are also risk factors that may contribute to postpartum depression, like a family history of depression, or sexual trauma and abuse, or drug and alcohol abuse. Also, if a mother has experienced postpartum depression in a previous birth, she is more likely to experience it in her current one. Counseling and therapy is recommended for new mothers and fathers experiencing postpartum depression, such as cognitive behavioral therapy or interpersonal therapy, which involves talking to a trusted therapist and working through triggers and coping skills for the disorder. Medication may also be recommended, such as antidepressants or estrogen. As always, it is recommended for new mothers to speak with their providers about what works best for them, because estrogen and some antidepressants may be transferred through breast milk. There are a few recommended tasks to enhance the treatment of postpartum depression, such as staying active, exercise, keeping in touch with family members and friends, asking for a hand, planning alone time and activities, refraining from drugs and alcohol, and eating healthy food. Postpartum depression is misunderstood, but it's very serious and it's common. It's no fault to the parents, and it's recommended to seek treatment as soon as possible to ensure the health and well-being of the child and to help enhance bonding for parents and child.